So hi everyone, I'm Amy Confer. I'm the Assistant Director of SERP, or Office of Community Engaged Research and Practice. I personally am very excited about the speaker that we have today, which is really focused on community engagement. So Dr. Xavier Morales is the Executive Director of the Praxis Project, which is a national organization dedicated to supporting communities, building power for health. Xavier is a longtime advocate for community-driven initiatives to achieve health equity and environmental justice, taking an expansive view of what constitutes good health and community wellness. He works in partnerships to enable opportunities across the social determinants of health. He currently serves on the board of Urban Peace Institute, Boston Medical Center's Vital Village Network, and the Voices for Healthy Kids Strategic Advisory Committee, and the City of Berkeley sugar sweetened beverage tax expert panel. He studied environmental sciences at the University of California, Berkeley, and city and regional planning at Cornell. So without further ado, I'm going to hand it over so you can listen to his exciting talk.
Thank you, Amy, and for that intro and for the invitation, and Luisa for all of the organizing. This is probably one of the webinars that I've done over a long distance that I didn't feel as much stress about not knowing what was going on, just because every time I was like, well, what's going on? I'd get an email. So thank you for staying on top of everything. My name is Xavier Morales. I'm the Executive Director for the Praxis Project, and I'll talk a little bit more about the Praxis Project in a second. I just want to tell you guys first that I'm coming to you guys from Berkeley, California, where I live. Just outside our main office is in Oakland, California, in the Fruitvale district, for those of you who know Oakland and the Bay Area. And we also have an office in DC. Mostly just wanted to let you know, we always acknowledge the original stewards of the land, and they are, even though they may feel like they aren't around, they are around, and we should do everything we can to support them, to be acknowledged and not to seem invisible. The Praxis Project, we, again, national nonprofit, we work in partnership with national, regional, state, and local partners. And our main mission is to build healthy communities by transforming the power relationships and structures that affect our lives and communities. That's a pretty big statement. What does that mean? That means what we do is basically three things. The first thing is that we try to work with base building and community organizations to just help them do whatever it is they are doing better, faster, more sustainably, more profoundly. We don't come in with the national agenda and say we're all working on water, we're all working on parks. We feel that they are already working on the thing that's most important to them, so we don't want to shift their focus, and we just try to help them meet them where they are. The second thing we do is we create space. We try to create space within the mainstream world that seeks to ally themselves, or is also working on the same issues that our community partners are working on. And when I go through my talk, you'll start to understand why sometimes there's a need to create space within the more professional mainstream advocate world for a community-driven process. And then the third thing that we do is we make the case with funders that base building organizing needs to be supported for its own inherent value, for its own inherent action, rather than just always as a part of a research project. And we try to make the case that base building organizing should be the center of the funding. A lot of times funding will go to groups that aren't in the community, and the money just trickles into the community, and we want to kind of make it more of a direct partnership. So I'm going to go through this, and I know you guys all know all this. I'm just doing this for framing, just to get us onto the same page. So we all know that there's huge disparities in the United States. And right here, this is an image, a billboard image from the Health Happens Here campaign by the California Endowment. And basically, different zip codes have different life expectancies. And so the left zip code is in Stockton, California, and a child born today can expect to live 73 years, whereas the child on the right, born in Newport Beach, California, their life expectancy is 88 years. Again, that's just by being born today. And we see the same thing in space over by our office. We're in the Fruitvale. Life expectancy there is 72 years. You just drive a mile or two to the east into the Oakland Hills, and life expectancy there is 88. So we see that. And so, we also know that our communities, we're affected disproportionately by just about everything, whether it's coronavirus or it's, in this morning's New York Times, they were talking about shot deserts and they're talking about the vaccine, shot deserts and shot oases. And there again, the expectation is that in a lot of these communities that have these zip codes with lower life expectancies, these are going to be places where it's going to be really hard to reach folks and to make sure everyone gets vaccinated. When you go to, I keep turning the dial the wrong way. I apologize for that. When you go to the Center for Disease Control and Prevention website, you look at the 10 greatest public health achievements for the last century. They come up with this list right here, and it's great, all the stuff that has been achieved. But for another presentation that I give, I actually go in and I look at every single one of these achievements, and I can show using CDC data and other national data that communities of color and poor communities are not experiencing the same achievements. In fact, in many cases, some things are getting worse. In a previous presentation, the first time I made this presentation, I very unpolitically said that, if we keep doing things the same way, we're not going to actually achieve a difference. We're not going to actually make a difference. And I used that quote that's attributed to Einstein about, the definition of insanity. Apologies to folks that work in mental health, but it's the definition of insanity is continuing to do the same thing over and over and expect different outcomes. So back to this. So what is it that gives and takes away days of life? And again, I know that I'm talking to a choir, or I'm preaching to the choir here, because you're all in public health, and most of this is just to make sure we're getting the framing correct. And so these are the ingredients that Praxis uses, and we didn't make these up. These are all based on research that's been done by RWJ funded research, Centers for Disease Control and Prevention, WHO, Canadian Ministry of Health. So the dark text, those items are like the determinants. The more robustly present or absent these determinants or factors are in a community, the less, the shorter lives people will live, and probably with less health as well. And so what are the determinants of the determinants? We think that the text in the white, that starts to get at it. There's some items that are missing in there, but that we feel that these determinants that are in place are there based on bias, that historical, structural, systemic, that may be based on identity, race, disability, class, gender, religion, sexuality, ethnicity. And like I said, there's others too, including classes in there. So this actually opens up possibilities for us as we think about partners that we could engage in some of the work that we're doing to improve health in a particular area. And so in another presentation, I actually have a whole training where we actually identify why, like let's say on a sugary drink tax, why does someone who cares about hope and efficacy, why would they care about passing a local soda tax? And so, once you understand the why, then you can also, that gives you the message and the on how to go and get them engaged to participate in your project or to participate in the campaign that you're working on. So it helps us to identify partners, but two, it also shows us that the shorter life expectancy is not just about one thing. It's about an intersection of many things sometimes. When we talk about equity, we use basically the definition that RWJ has. everyone has a fair and just opportunity to be as healthy as possible. But we also see equity as a verb and equity as a noun. And when we just focus in on the outcomes, when we're talking about life expectancy, when we're talking about the presence or absence of these determinants, what we're really talking about is like the noun of it. We're not talking about the process and the systems and the structures that cause this inequity to exist. And so from our perspective, what we realize is that if we continue to just address the outcomes, we're going to have a harder time over the long term actually achieving the health gains that we're looking for. What we really need to do is transform those systems and structures that underlie that inequity. And a lot of times what happens is when we start to address the systems and structures, it becomes something that's political. It's not something that's technical. And so, I want to just give you like a real quick intro. I'm gonna go use the example of local soda taxes to kind of make the point about why it's so important to engage community and how it looks different when you do engage community in something that's contentious. So early on, pre-2014, pre-2014, when Berkeley passed the first soda tax in the country, people really looked at soda taxes from a very technical perspective. They actually quoted Pigou, and it was really about pricing something so that poor people wouldn't purchase it. It even went so far as I heard some of the advocates that were trying to pass these taxes is like, yeah, if the price goes up, then consumption will go down in the community, and therefore that will lead to better health outcomes, especially type 2 diabetes, cardiovascular disease, and so forth. But they didn't even. At that time, I actually had one advocate tell me, and I'm agnostic about where the funds go. I just want this price to go up. So for them, it's a very technical approach. It's like, price goes up, people without a lot of resource will not consume, will not purchase. But as part of my advocacy, again in California, this event right here that I took a picture of really enlightened me to like what was really going on, that it wasn't just something that was technical. Right here, this is a picture of what's called the gate. And this is the gate that leads into the Senate floor, the California Senate floor. Right here's the gate. And we were advocating for a soda tax. And our lobbyist was down here at the gate, and me and my team, we were walking around the legislature, meeting with different offices, making sure that they didn't have any last second questions before this thing came up for the vote. And so I get a call from my lobbyist, and he's like, hey, you got to get down to the gate right now. And I'm like, the gate, what's that? So anyway, he tells me where it is. I run down there, and it was like a feeding frenzy. All of these are lobbyists right here. And what they do is they put on they submit their card to a page, and it says the name of a legislator, and it says a topic. And then the page takes that in and they give it to the legislator. And if the legislator agrees to come out, they will come out, and then they go into a little side room and they talk. And it's like last minute deals that are happening. But the thing that amazed me the most here was when I realized who all was up against us. I expected the beverage industry to be lobbying against us. I expected the Restaurants Association, the Grocers Association. I expect they were all the usual suspects. But then when I saw others like the oil industry, and I'm like, there's little us and our little coalition of health advocates. But here we got these major corporations that are here trying to block what it is that we're trying to do. And so, with that experience, what that really told me was that this isn't just a technical exercise that we're doing. And when you optimize in the technical world, it's a lot different than optimizing in more of a political world. And so, the work that we do, it's really grounded in, power. It's grounded, and then it's also grounded in to go up against that power, the way we've been doing it with just health advocates, the professionals going up against industry, we haven't been winning. We need to engage other allies to help us, and that's where the organic intellectual, the community power, the creating consciousness in community, the organizing. That's where this all starts to come in, because we need to engage our communities to be able to go up against these major industries that have a lot of political power by virtue of just their position and also economic resources that they have and what they can do with those economic resources. And so, but how do we get community to become involved? And again, in the past, pre-2014, a lot of the tax campaigns, they didn't involve community, and they kept losing, like about 30 different attempts, and they all lost. What Berkeley did, and this wasn't because we were super brilliant or had super insight, we were just trying to win politically. And we had some really astute folks that were part of our core campaign. And so the first thing they did is they went and talked to Dr. Jeff Ritterman up in Richmond, California, which is just north of Berkeley, to say, what would you do different? Because Ritterman had tried to do a campaign up in Richmond, and it just fell flat, really flat. And he's like, what would you do? What would you do different if you were to do this again? They went down to El Monte in Southern California, another place that just fell flat. The beverage industry just came in and decimated their attempts. And they said the same thing that Ritterman did, which is bring the community into the table. Anybody that the beverage industry can wedge, bring them to the table from the earliest on, and have them help to design what it is that you're doing, have them help have complete buy-in for what it is that you're trying to do. Because without them, without the community, you're not going to win. And so, again, I live in Berkeley, so I was fortunate in that, I was the co-director of Latinos Unidos at Berkeley at the time. So I was targeted to come in early on. Another an African-American doctor, her name's Dr. Vicki Alexander, was the founder of Healthy Black Families. She was also invited to come in. And, the first thing that we did was we looked at the soda tax that our city was trying to pass, and we were like, you know what, this doesn't really benefit the community the way we think it should. And from research, we also know that it's communities of color, people with less income, the newly arrived, that actually purchase and consume more soda. So we're like, this, in fact, what our group was presenting before, what they wanted to do, it could have been argued to have been regressive against the community that was actually going to be paying the tax. And so we said, the fact that you guys are saying that just raising the price is going to be a good thing because it's just good for you communities. And we would say, but this might be regressive. They would say, well, it's the, diseases are regressive too. So that's the justification. Because diseases are regressive, this is good for you, so we're going to do it. That doesn't engage the community. That doesn't bring the community to the table. So instead, Dr. Vicki Alexander and I were able to come in and say, you know what, for this to be more equitable, this is what we need to see. We need to see the money going back into the communities that are most affected by the consequences of consuming sugary drinks. And we need to see that this money is actually going to, let me see, I have a slide on this. We need the money to go into the areas that are exhibiting the highest rates of inequity. We need to invest in the community defined priorities. Here again, this is, we need to meet the community where they are working on their health priorities. We shouldn't be coming in and saying, this money is only for water. If the community themselves say we're food insecure and this is what we need the money for, or we want pre-K and this is what we need the money for, then that's where the money should be going. That's how you're going to get the community's buy-in. We want to make sure that the investments are not going to organizations outside the community and building their capacity and structure. We actually want to build the infrastructure of the community groups themselves that are in the area to deliver services and programs to help people, live more healthfully. And then the last thing that we said is we want to make sure that any investments that we make build community capacity and infrastructure that can actually transcend the grant period. It's a longer period of time. What we're doing right here is this is actually the beginnings of starting to build power, helping community groups to build power in the areas where they live, so that today they may work on addressing issue A, but as they build their capacity and infrastructure through the funding that they receive here to address their priorities, they'll be able to move over to issue B and issue C over time. And actually what we've also seen in other places is that in this process, you start to see leadership develop as well, community leadership develop. And this leadership, can one, more effectively impact policy at the local level, but two, we've also even seen many of these groups actually have leaders that have been voted into office. And so, this is different. When we talk about instituting a soda tax and raising the price so that poor people can't afford it, and that's how we're going to improve health, that's really short-sighted. And that's really, in my mind, it doesn't engage the community in a way that values the community. Whereas this other way, this way where we center equity and we make investments back into the community, we're actually valuing the community. We're valuing their agency, and that's how we're going to improve health over the long term. And so when we do invest in community, I talked about this a little bit, programming and activities, we want to counter the industry's marketing. We want to make healthy options available and accessible. And we want to make sure that we're countering the beverage industry's marketing power through influencers as well. But the first one at the top right here, I remember some of my mainstream public health partners, whenever I talk about community education, we want to use these funds to make sure that we're educating the community about the dangers of sugary drinks, or about, making sure that they don't drink sugary drinks. They would always tell me, you know what, the research shows that education does not work. We're not going to move the needle if we just do education. And that's where I realized also that we have a totally different concept of what we're talking about when we talk about education. We have a different idea of where we're starting. What's the starting point? Because for my mainstream partners, it was really about the health effects. It's a technical thing. This product makes you sick, so therefore you shouldn't drink the product. Whereas for us, it's a political thing. And it's like, we start from the basis of, why is it that our communities are drinking so much sugary drinks to start with? Why is it that soda is cheaper than water in our stores? Why is it that, our food systems, all we have is fast food in our area. We don't have full service grocery stores. And when you start from that place, it's actually a lot easier to engage community and bring them into the fold than when we start by saying, don't drink soda because soda is bad for you. I mean, they may agree with that, but once they understand the level of manipulation that's going on, they become very strong allies. And just quickly, I know I got 5 minutes left. I wanted to show you guys, this is directly from Berkeley. I serve on the commission that actually makes the investments, and I'm sorry for the haphazardness of the slides. I'm not the best graphic design person, as you can tell. Anyway, so Healthy Black Families has received significant funding from us, and you can see the links to their website on the left-hand side on the bottom, and on the right-hand side, we've actually made videos that shows how they're using their funding. And so you see that, the first example of just raise the price so that poor people can't afford it, versus the second way where you actually build capacity, build knowledge, build consciousness, and you actually make the healthy choices actually available into the community. It feels a lot differently, and you get the community, and you get the community's buy-in, and they will actually defend this moving forward. So this is Healthy Black Families. The Multicultural Institute, they do incredible work with day laborers. These are folks down here on the lower left. These are day laborers that stand on corners waiting to get picked up for day jobs. And you see these guys going out and doing these presentations. And today this guy had a soda right there, but I also heard later on that when they went back a few weeks later, he had a big thermos that he wasn't drinking the same soda anymore after the presentation. And then they also work with they use the funding to work with the children of these day laborers and their families to teach the children about what's healthy and what's not healthy. And then they also do other things with their funding to make sure, you know, the referrals to dental care and also to clinical care. YMCA of the East Bay, their Head Start and Early Head Start program receives significant funding. And, you know, again, this is generational change that's happening here. They work with all of these little kids, upper right-hand corner, to talk about, you know, what's healthy and what's not healthy and why one would not drink sugary drinks. And then they also have a food pantry that they serve the parents of the children's families with as well. And then the Ecology Center, they use their funding for leadership development, the leadership development in the context of urban farms. And it's a great program what they've been able to do. And so, you know, this is kind of like the two different sides for me right here. The left side, the perfect strategy, and I'll tell you that each of these elements, the 2 cents per ounce, the dedicated tax, the retail tax, that these are all researched and you know, they've been optimized. Our research partners have told us that unless the tax is at 2 cents per ounce, we're not going to see any shift in consumption. Unless the tax is a dedicated tax, meaning that it has to be specified that it's going to go to health improvements or health programming, that it's not going to work. And then the last thing was that it should be a retail tax as opposed to an excise tax. Not only do they want the price to go up, but they want the consumer to see that they're paying more. And that's the strategy to improve, to decrease sugary drink consumption, so that health can improve in these communities, in these targeted communities. Whereas the right side, you know, it's not the perfect strategy, it's the good strategy. It's the strategy that won. We felt that 2 cents was a lift, and we looked at 1 cent, and 1 cent worked for us. We decided to do a general fund tax, because in California, to a dedicated tax, you have to win at 66%, whereas a general fund tax, you only need to win at 50% plus 1. And then we also made it an excise tax, where the distributor pays the tax when they bring it into the city. So the grocers don't have to do anything different. The consumers, they don't see something that says soda tax on their receipt. And it's still unclear whether that excise tax is being passed along penny for penny. But here's like the big innovation here: the panel of experts overseeing the investments and making sure that the city was investing back into the community in the ways that we had originally conceived, and went back to our communities and said, yes, this is a good thing because it will help us, and this is why. And so, you know, the focus here is on investing in community-led efforts and initiatives, and success is defined by behavior changes resulting from investments that build up on community agency and efficacy over the long term. So, you know, very different approaches. One's very technical, that doesn't have a lot of community input, and the other is pretty much centered community and centered equity. I want to leave you guys with one last slide, and I'm gonna have to switch between screens. And let me see if I can do this. We have this resource available on our website where we talk about what it means or how it should look when we go into a community to work with community. You know, we have these 5 principles, and we worked on these principles with our community partners, national community partners. So the first one is act with care. Second one is inclusivity. Third one is authentic community collaboration. Third one is that the solutions that we're developing should be sustainable. And I'm misnumbered. The fifth one is a commitment to transformation. What usually happens is when you bring folks into the table, they come in with their lenses, you come in with your lenses, and both sides are going to be transformed a bit. And the outcome that you have, depending on how equitable it is, will actually probably be better positioned than just either one side coming to the table on its own. So this is a whole nother presentation as well. And I want to thank, let me see, I'll stop sharing. I want to thank you guys for giving me the 30 minutes this morning. And Amy, again, thank you for the invitation. And this is exciting work. It's not easy work. It's hard work, because a lot of times when you go work in community, the first, you have to develop a level of trust. You got to show up. It's got to be, you can't just be coming when you need something. And over the long term, as that trust is developed and built up, you'll have much better outcomes when you work together. And that's a very superficial ending, but that's what I got this morning. I apologize.
That was great, thank you. And I could tell that people are excited also about what you're speaking about. Please add more questions to the Q&A so we can continue the discussion. We really would like to make this an engaging discussion for the next 30 minutes or so. I'm going to start off with a question just because I can. So what you talked about makes a lot of sense, and it's similar to what happened in Philadelphia also, where the beverage tax finally passed because of where the money was going, not necessarily why, like for the public health reasons to pass the beverage tax. I was wondering if you engaged with academic partners in this process, and just thinking in general about the process of policy and advocacy and engaging with community, where you see, for us, where you see public health faculty or public health students or staff, basically the public health academics fitting in with community and advocates and nonprofits and policymakers.
So this is 2014 that I'm talking about on the Berkeley soda tax. And at that time, the academics that were coming to the table were arguing for that perfect. And it was really hard to get them to move towards the good because the frame was, unless we raise the price and the community knows that they feel that price increase, we're not gonna move the needle. They were right. It was a very technical approach. So we've got some incredible, we've got some, I don't want to name names. We got some really incredible public health folks that came in and participated with us. But I'll tell you that it took a lot of pushback to say, no, this isn't about just the price going up. This is about taking in these revenues and investing them back in the community and building capacity and building power and making sure that the healthy alternatives were actually available, building leadership. And that's the way we're going to achieve longer term health. And so early on, it was hard. And they weren't wrong because, I mean, they could show us all the research. They were right. And they optimized everything. They used the models and it worked. The models were true. But again, it was a very technical approach. And it's like you're fighting a technical battle in a political world. And so it's just really important to make sure that when we come in, we understand the politics. And I mean, to their credit, we had Robert Reich that would come down. He didn't weigh in either way on what the amount should be or anything like that. He was just big on like beating big soda. So Robert Reich came in from the university. We had some other, national leading public health researchers that were coming in as well. And I think that now that we have gone 5 years with our soda, we started in 2015. We're just doing our 6th year, starting our 6th year. Actually, we're reviewing proposals right now for this next couple of years. We've actually got a couple of researchers from Cal sitting on the committee. And it's really interesting that now that they've seen how this all works, they've become bigger proponents for this. I've seen the shift, and it's not about being right or wrong. It's just about the context that we're in and and being able to adjust to it.
Yeah, I think it's important to think about the context and to think about where the people are coming from in politics and to think about what's going to work to move the needle, not necessarily always achieving the best possible thing. I think one of the biggest lessons in community engagement also is just meeting people where they're at, meeting people in a spot that's going to be important to them. We do have a question from, I'm not sure who, because it's anonymous, but it says, you allude to the lack of availability of healthy choices. Many communities are in food deserts. Have any of these types of programs resulted in improved choice and availability of full grocery stores in communities, or are there good choices essentially improving food access?
So I'm gonna come to that in a second, but I just want to reflect on what optimizing. We all optimize differently, and so I think that I think it's hard for folks that have, like, I've worked with people that have built careers on developing these economic models, and their models are really, really strong, and it's really hard for them to back off of just the outputs that these models are giving because they're not optimized. And so I think that when we work with community, we have to give a little bit. We have to figure out, well, this is my optimum, but what is the optimum in the community? And then also you got to figure out what's the optimum politically. And then at that point, you got to decide, okay, is this something I want to engage in or not? Because maybe I don't. Maybe the optimum's not enough. What is this person from? His name is Vic Coleman. He's from Washington State. He's like, is the juice worth the squeeze? I never heard that before. So you gotta. There's a lot of considerations. It's not purely technical. And then the funding that's been come out, and I'm going to reflect on Oakland, San Francisco, and Berkeley because all of us have passed the soda tax. And to a certain extent, Seattle, and especially Seattle with the food security. A lot of their funding has gone to food security. So while it may not have opened full service grocery stores in communities that had food deserts, it did create opportunities for making healthier food available in those deserts. So I know that in Berkeley, we've actually funded Spiral Gardens. They're a community community garden, and they do programming in their community area. They do health programming with children from the schools and also with the community. We funded Healthy Black Families that works closely with the Ecology Center. That Ecology Center runs our farmers markets. And so, the Ecology Center, and they also work with Black churches. And so they work together to create pop-up stands on certain days at the churches so that these fresh fruits and vegetables are more readily available. I know that in other areas, they've used it for increasing market match. So more dollars that go towards purchasing fresh fruits and vegetables in these pop-up and farmers market type settings. And I know during COVID, especially in San Francisco, they shifted a significant amount of their tax revenues towards food security and some of the most vulnerable communities. And the avenues which they put this money out were through churches, through schools, through immigration groups, and through maternal health groups as well. So not a direct answer to what the anonymous person asked, but this money is being used for some of that. And if you think about it over the long term, especially if you think of a group like Healthy Black Families, the advocacy, the political strength that they're gaining, the leadership that they're gaining, not only, they may be able to use that increased capacity to engage in the policies in the city to make sure that we can steer future siting of these amenities into communities that don't have them now. And over the longer term, we don't have evidence on this yet, but over the longer term, some of these folks may actually become elected officials themselves, and they can do it from there. So we talk about the building power approach, even though we may not see in the immediate 2-year period or 3-year period since we've had the soda taxes, but over the longer term, if we can continue to sustain this investments, we may see this. And I know we've seen it in other areas, not related to soda taxes, but we have seen it in other areas. Think National City in Southern California. It's amazing the amount of community power building they've done over the last couple of decades. And you see their mayor now is someone that came out of community, and it's just the whole leadership at the city, there's been like a total mind or change in philosophy. You have people from the community that have grown up there that are now in positions of power that used to be working in community groups. So there's definitely evidence out there that when you work to build power in communities, that you can achieve these longer term structural outcomes that improve health. And Berkeley's soda tax and all of the other soda taxes that have been passed, the timeline on that is still really, really short. So we're hopefully over time, we'll see the same type of results.
Yeah, I love that. I love what you're saying. It's really about building capacity and building empowerment and talking to community members and community advocates about the process and how to move things like this forward. While you're working on one project, it helps everyone kind of think about the next project and the next project and the next thing that you can move forward. I was wondering, because we don't have a ton of questions coming in, if you wanted to spend a few more minutes on that last slide that you were posting, just talking a little bit about, essentially how to go about community engagement and the important things to think about, the important things to keep in mind, and to, progress community engagement in that way.
Yeah. So do you see, which slide do you see?
So I'm out with the circle and the.
Okay, good, because I have two screens and the other one's my slideshow. So, the first one, the act with care, that one's super important because, and I'm guilty of this as well. Coming into a community and not really understanding, and sometimes we see the results. We see the possibilities and don't understand why they're not why they aren't doing it. So act with care, it really comes from this. It's a refutation of this concept of move fast and break things. And we live just north of Silicon Valley here, and the thing is that the conditions in our communities sometimes are really vulnerable. And for us who come in with privilege and power and resources and try to get folks to adopt whatever it is that we're saying or optimize the way we're optimizing, that that they're not bought into, we can do harm, and then we go away, we go home, whereas they have to live with it. So that's kind of the underlying piece for that concept, to act with care. The second is inclusivity. And, again, that just kind of speaks for itself, but just making sure that as many sectors of the community are at the table, that, and usually you want to do this in two steps. You do the first one where you go in and you work with a leader and you say, can we get a few people and let's run this idea past them, or what ideas do you have depending on the project? And then, once you get that first group of people and that the community leaders have identified, you again present to them what it is that you're all going to collectively do. And then you ask this small group again, who else should be at this table? So you do a couple of layers. And that's one of the best ways to make sure that you're getting everybody to the table that should be there. When it's a community that understands what it is that you are collectively trying to do and are bought in, they're like, oh, we need to have these other people at the table too. That's when you've kind of that's a good solid group to start with. Then the third one, authentic community collaboration. And, this is going back to I come from urban planning. So it's Arnstein's ladder of participation. That's what I think of when I think of authentic community collaboration. Are we just coming in to use the community to achieve what we're trying to achieve? Or are we coming in to work with them as full partners in not only defining what it is we're trying to do, but also that, they own the process, and that, maybe this process can continue even if we're not at the table. So just more authenticity in that collaboration. And then the third one is sustainable solutions. Fourth one, I'm sorry, I keep misnumbering. Sustainable solutions. And again, this is the solutions that we see may not be solutions that are lasting. So I go back to this perfect strategy versus the good strategy. The solution that my partners, pre-2014 felt that was viable for improving health outcomes such as diabetes, obesity, heart disease, cardiovascular disease was to just get people to stop drinking soda by raising the price. That solution, one, it didn't pass, but two, just really didn't feel sustainable over the long term. But this other one where we actually build power, if our goal is to improve health in general, you know, that and not just related to sugary drinks, but overall health, you know, really this building power approach really is more about a sustainable solution over the long term. And then the last piece, the commitment to transformation, I talked about it a little bit earlier, but again, that really is about understanding that as we come to sit at the table, that the ideas are going to change. Think about it this way. I mean, all of us write proposals, right? We're always writing proposals that we're trying to get funded. More often than not, we have to collaborate with partners now. And you know, sometimes we'll get an RFP and we'll say, yeah, I want to go after this, but you know, I can't do this without these other partners. Well, you bring everybody to the table and you kind of share your ideas, and all of you share ideas, and the initial concept actually will change given everyone that's around the table. So that's kind of like the commitment to transformation, but not just the technical transformation, but also as we start to understand these folks that we may have never worked with, as we start to understand just like their perspectives and their lenses, you know, that may change our lens and our perspective in other areas as well. So you know, and it's typically a good transformation that happens.
Thank you. I appreciate that so much, just walking us through that. We do have another question. It says, your comments about the way outside groups can come in, see potential, and do harm seems to describe quite well the way universities often approach community. What have you seen has been most helpful in shifting university approaches in this area, especially allowing community to lead rather than paternalistically attempting to force their own solutions on a situation?
Ryan, you didn't hold back there, and you're not anonymous. You know, when I finished my PhD, I went out and I did I was in a postdoc. So I finished up in New York and I moved to Arizona and I was in a postdoc. And I was at a center and my job was to go and work with community. And I just, you know, I couldn't do it. I have some really incredible university partners that have done this and they've been able to do community engagement well. I just couldn't figure out how to do it. I wasn't as smart as them. So I actually ended up leaving because I was, you know, on the track that we all strive for. I ended up leaving and actually working. I decided to just completely work with community. I was single at the time, so it was an easy decision to make. But you know, the part that's hard on this is our university partners are they're brilliant people, and sometimes it's just really hard to get somebody that's brilliant to just take a step back. But having said that, you know, there's some funders that are actually requiring more authentic collaboration. I think communities are getting smarter about, you know, not being tokenized. But I also think that there's a lot more folks coming through the university system that also have they come from community. And so, you know, so I think things are shifting. You know, even today, one of the leading persons in soda taxes, he's university based. He and I still argue about the benefits of, you know, just raising the price so poor people can't afford sodas. We still argue about that. And, you know, we've co-authored different things together about equity, but he still says, yeah, you and I are always going to disagree on this. And I'm just like, okay, but you know, I know where you stand. And so in the future, I know that if I'm going to work on X and I really need to be committed to equity in this project, and I'm going to be introducing you to my community partners, well, maybe I'm not going to do it. Maybe I'm not going to work on that project. I'm going to work on something else. So I don't know if that's a good answer, Ryan. I think that things are shifting. I think it's hard. The university system is, you know, what's it, based in a monastic tradition, you know, where you have to be approved by and judged by folks who may not understand what you're doing. So I think that sometimes, you know, it also reflects on not just the person that's trying to do the work, but it's also the institution that's going to reward or not reward. So having institutions change the way they reward different types, and also understanding that there's different types of research. It's not an answer, Ryan, but I am seeing things change a little bit.
Agreed. The shift is happening slowly but surely, I think. Definitely. All right, I think at this point, I'm going to give everybody a break before their 2 o'clocks. Thank you so much. It was really wonderful to have you, and I think really impressed by all the work that you do, and impressed by how to get things done and the advice that you had for us. So thank you very much. And I know that I can connect anybody if they have further questions for you as well. So thanks for joining us.
Yeah, thank you guys for the invite. I just wish I could have been there in person. Well, not right now when we have to wear masks and all that stuff, but maybe like, I love going to Philadelphia. It's a beautiful city. So it's really good to meet you guys all, and thank you for the opportunity.